The forehead is one of the most important parts of any facial feminization surgery. It tends to be the thing that, in and of itself, is one of the most feminizing aspects of the surgery. There can be multiple aspects to what it means to achieve a feminine forehead. There's at least a half a dozen different features of a forehead that need to be attended to while feminizing a forehead, and leaving any one of those 6 things undone is going to leave you with an unsatisfactory result in terms of the cosmetic appearance of your forehead, aside from the number of things that you could do to essentially make a forehead look worse, which you don't want to do that. The hairline is one of those things. Hairlines often need to be lowered. We feel very strongly that hair transplant should be a finishing operation, if they're ever even necessary, for a patient after a hairline has been adequately lowered. The reason for that is that hair transplants tend to not be as thick as your natural hair, and they therefore tend to look a little bit thin for use in primarily lowering a hairline, whereas they tend to look fairly good in the corners and the temples. They look good for camouflaging a hairline scar if you have one. The other situation is that once you already have hair transplants, it can often make it fairly risky to go in and, number 1, access the forehead, or number 2, lower your hairline, and therefore don't put your surgeons in the position of having to tell you we can no longer do your forehead, or you're going to undergo a substantial amount of risk by becoming impatient and getting hair transplants early in the process rather than waiting and using them as a finishing touch.